So good afternoon, everyone. I hope you all who are in Chapel Hill area are keeping dry. I am Ruchi Mehta, a fourth semester grad student in biomedical and health informatics program. I did my research internship under the supervision of Dr. Lisa Weisel, who is a research assistant professor with UNC School of Medicine. I performed a quantitative analysis to understand language changes in people with and without history of trauma in the light of COVID-19 pandemic. So this is the agenda for today's presentation. The introduction. So people with history of trauma are affected more than others when they experience subsequent traumatic events and can experience APNS, which is also known as adverse post-traumatic neuropsychiatric sequelae. The signs of APNS includes, but are not limited to, post-traumatic stress, depression, post-concussion syndrome, and regional and widespread pain. COVID-19 pandemic was unprecedented time and had affected billions of people physically, mentally, and culturally. It is particularly important to monitor people with a trauma history for APNS during and after subsequent traumatic events like COVID-19 pandemic. Health status affects behavior, including the language. The use of social media to study mental health has increased in recent years, since it provides a readily available source of data about behavior and language. The aim of the study is to analyze unstructured data from social media, which is Twitter, and quantify the change in language in the light of COVID-19 pandemic. There are three study questions that this study aims to answer. First, do people with a history of trauma use higher rates of negative emotion and first person, singular or plural pronouns than those without history of trauma? The second question is, do people with more severe traumatic experiences use higher rates of cognitive process and death or dying related words? And the third question is, what are the words that started emerging during COVID-19 pandemic? So the overview of the study process, the preparatory stage, literature review and development of study research methodology, finalizing the sample size and survey methodology with help of NC tracks, and developing research documentation and gaining IRB approval. The second part was to recruit participants. The participants for this study are being recruited using the web-based participant recruiting site called Cloud Research. And the final stage of the study is scraping data and analyzing this. Using RStudio, scrape and clean the Twitter data with handles provided by the participants and analyze the data using the LIWC or the Luke software. The eligibility criteria for this research study is that the participants must be 18 years or older. They must be willing to provide, they must be using Twitter since January 2019 and should be posting on Twitter at least once a month. The participant recruitment. The cloud researchers platform named Connect is being used for the participant recruitment. Connect is Cloud Research's own crowdsourcing platform for online research. Since Connect does not allow in-survey screening, we are deploying two different surveys. So the first survey is taken from surveys taken by a larger population, and we screen them to understand if they are willing to provide us their Twitter handles and their trauma history. Once we know the eligible candidates, we extend them to fill out our entire survey. The entire survey, in the entire survey, we gathered the information about participants' demographic information, their Twitter usage and handle, and also self-reported history of trauma using UNC Qualtrics. So this is the snapshot of survey. Uh, the trauma questionnaire consists of 8 different questions, which are related to basically if they have been in serious accidents, if they have been involved in natural disaster, if they have lost, if they have experienced death of some near relatives, captivity, war, etc. The survey also asks about participants to provide information about if they or the loved one have experienced the trauma and the amount of distress caused by it, which is used in the analysis to calculate the severity of trauma. So there are 3 stages of analysis. The first is scraping and cleaning Twitter data using RStudio. The second stage is analyzing data using the LIWC or the Luke software. And the third is creating the visualization. This is a snapshot of the code that I have used for Twitter data scraping. I've used Twitter developers account with academic authentication as it has the higher tweet scraping cap, which is 10 million tweets a month. The main libraries used for scraping are academic twit R, tidyverse, and writeXL. There is another library known as TM, which stands for text mining, which was also helpful in developing this. Okay, so what is LIWC? LIWC, which also stands for Language Inquiry and Word Count, is a text analysis program that calculates the percentage of words in a given text that fall into one or more of over 80 linguistic, physiological, and topical categories, including various social, cognitive, and affective processes. So for example, if we give LIWC to analyze a text document or a speech which is containing of 1,000 words with using the built-in LIWC 2022 dictionary, it might find that there are 50 words which are related to positive emotions and 10 words that are related to negative emotions. So LIWC would convert these numbers into percentage and give us 5% of positive emotions and 0.1% of negative emotions. Data analyzed for this presentation. So I would want to put it out there in the beginning that the data collection for this research is still in progress, and these are intermediate results. We are still to perform the test of significance. The data that I have analyzed for this specific presentation includes total 20 participants. The data is from January 1st, 2019 to April 10th, 2023. There are 12 participants with the history of trauma and 8 participants without history of trauma. The data, as I said, data collection is still in progress, and till now we have scraped about 200,000 tweets. All right, so the usage of first person pronoun and negative emotion words in people with and without history of trauma. The literature suggests that the higher use of first person singular pronoun can be indicator of presence of depression and trauma. Literature also suggests that individuals who have history of traumatic experiences tend to use more negative words or use negative emotional tone while expressing themselves. The categories that I have used for the LIWC kitchen for this analysis are the 2 variables called P pronouns, under which there are I and we. And for the negative words and negative tones, I have used the emo neg and the tone neg variables that are listed under the category of affect category in basic dictionary of LIWC kitchen. Let me remind you all that the data that we have analyzed till now is a fraction of what we are planning to analyze. However, we can see the variable, the P pronoun in emo negative and the tone negative are consistent with the information available in the literature. We can see that there is significant difference between the first person plural pronoun between two groups. However, as I said, this is just a fraction and the analysis continues, and we are hopeful that we would see something similar that we find in the literature in this research as well. The next thing is the usage of cognitive process words and death/dying related words in participants with higher trauma scores. As we talked about how the survey is crafted, we collect the presence of trauma, who was the victim of trauma, and how much stress did it cause to the participants as part of the survey questionnaire. Using this information, each participant in the trauma group is given a trauma score. There are total 12 participants with trauma history in this sample data, amongst which 3 had score 1, 2 of them had score 2, 3 had score 3, and there were 2 participants each in trauma group 4 and 5. The variables that are used for this analysis are cognition from the basic dictionary and depth from the expanded dictionary. So because of the data that we have analyzed is a smaller sample, we cannot see a significant difference in all the trauma group. However, there is a significantly higher usage of cognitive process words in group with highest trauma score, which is 5. Comparison of usage of death-related words in participants with different trauma scores. So in the death-dying related words, we can see that the data analyzed is almost in accordance with the literature. However, we need to perform test of significance before establishing or stating that there is certainly similarity between our research study and the literature. All right. So the last question that the study tends to answer is the word usage and emergence of new words during COVID-19 pandemic. We wanted to see how the progression of COVID-19 pandemic affects the word used by individuals on social media. In order to see emergence of words, we agreed upon 4 time frames that are similar in length and can signify the timeline of COVID-19 pandemic. The 4 time frames that we have chosen are from April 2019 to March 2020, April 2020 to March 2021, April 2021 to March 2022, and April 2022 to March 2023. The expectations were to see the words like COVID, isolation, N95, quarantine emerge after March 2020. Similarly, emergence of words like vaccine, shot were thought to be emerging after March 2021. Due to low volume of data that we have used currently, only words like COVID and vaccine can be seen emerging in this data. However, with more data, we are expecting to see words like coronavirus, hospitals, quarantine, isolation emerge periodically as the pandemic evolves. As you can see, the first word cloud is from the data that is from 2019 to April 2019 to March 2020, which do not have any words similar to COVID, hospitals, or anything like that. But we can see the word COVID being emerging in the data that is between April 2020 to March 2021. And as we progress further, the words like COVID as well as vaccine are being seen emerging in the data that is from April 2021 to March 2022. And if you can observe, the size of the word COVID has increased in the word cloud for April 2021 to March 2022, which means that the usage of word COVID has increased. And similarly, you can see the size of the word COVID had decreased in the data, which is from April 2022 to March 2023, which also signifies that people have started talking about the other things than COVID. Next steps. So the data collection for this entire project, the sample size has come down to 500. So the data collection is still going on. The next steps would be to complete the data collection and start analyzing the entire data. Once we have analyzed all the data, scraped and analyzed all the data, we would be performing test of significance to establish the relationship between literature and what we have found in our study. Challenges. Collaboration. So we collaborated with NC Tracks to ensure the correct survey methodology and sample size. The collaboration with NC Track provided a great insight on development of survey methodology as well as sample size. However, the back and forth communication between us consumed a lot more time than we originally anticipated, and it just increased the timeline that we had in mind. The second challenge that we have faced was the data collection platforms. So the new sample size came for the study came down to 500, and we had to change the way that we were collecting the data. So we chose this platform called Cloud Research to collect our data. And we had a call with the representative from the Cloud Research platform who advised us to use a platform called Prime Research for the participant recruitment. However, after the launch of study, we were informed that the data that we are collecting has Twitter IDs, which is a private information, is not allowed to be collected using that platform. And we had to terminate and shift our entire project to another platform called Connect. And after shifting the study to the new uh, platform called Connect, we were informed that there is no way that we can have in-survey screening. Thus, we had to come up with another uh, survey that can be used to identify eligible participants and then send them follow-up study so that we ensure that we are getting the right data. And the last challenge that we are still facing is the data quality. Despite all the efforts and having assumption that online participant recruitment is going to be accessible and easy, we realized that there was problem with data quality regarding people providing fake or wrong Twitter handles, and that has increased. That has caused a lot of problems in ensuring the data quality. The lessons I have learned. First, so I come from a clinical background. I have worked as a dental practitioner in India for 3 years. I also assumed the role of clinical data analyst for about 8 months, but I have never worked in research. So this was my first research project, and I have learned so much about research working on this project, especially how to design and develop and deploy surveys. I have worked with medical data, but most of the time, it was the EHR data. So fetching data from multiple platforms and combining them and using them for a single analysis was something that I learned in this project. I have used the R language before, but using R language on this extent for scraping, cleaning, and analyzing the data was a very interesting experience and new learning experience for me. Once again, I had never used the LIWC or the Luke software, which I got to use. And it's pretty interesting to know how things work and to get to be introduced to a new software. Also, I got to collaborate with so many people, so many multiple teams within the research domain, which was very important lesson for me to learn because I am somebody who is kind of introvert, and collaborating with so many multiple people, multiple teams just made me a little bit open about what I want to do. So, yeah. And if anybody have any question for me.